Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I'm here today with Commissioner Ken Lawrence, and welcome to our press briefing for July the 8th. We are in week 18 of the pandemic here in Montgomery County and our second week in the green phase. As many of you know, we have not updated the data on our County Hub website since July the 2nd. On Monday, July the 6th, our staff realized that a large number of duplicates had been overlooked in the July 2nd data. It has taken until today to double check and reconcile all of the numbers. I apologize for this delay. So for today's numbers, I am reporting starting with July the 2nd. So on July the 2nd, we had 32 cases, 5 of which were from long-term care facilities. On July the 3rd, we had 42 cases, 2 of which were from long-term care facilities. On July the 4th, we had 27 cases, 3 of which were from long-term care facilities. On July the 5th, we had 1 case, not from a long-term care facility. On July the 6th, we had 41 cases, 2 of which were from long-term care facilities. Yesterday, July the 7th, we had 40 cases, 7 of which were from long-term care facilities. And today, July the 8th, we have 48 cases, 6 from long-term care facilities. In total, for the 7-day period since July the 2nd, we have 231 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 8,626. These positive cases are a result of the positive test for the virus, not the antibody test. In total, 25 of these cases were from long-term care facilities, and 206 were from the community. These positive individuals are from 41 municipalities. 61 of our 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 1 month old to 95 years old. And our county map found at montcopa.org/COVID-19 will be updated shortly with all of these numbers. It will take a little longer to update it. So again, please continue to be patient. Today we had in total 139 females, 91 males, and 1 person that we don't have the data on for gender. I'm also saddened to confirm that 4 more Montgomery County residents have lost their life to COVID-19, which brings us to 804 deaths confirmed positive from COVID-19. 2 of these individuals died at a hospital and 2 at a long-term care facility. They ranged in age from 86 to 93 years old. In total, we have lost 426 females and 378 males. The racial breakdown, and again, this is self-reported data as we have it, 18 Asian, 3 Asian Indian, 3 Asian Korean, 99 African American or Black, 309 white, and 372 unknown. Today, we do not have data on probable deaths. In terms of our hospital bed update, as of today, we have approximately 69 individuals hospitalized with COVID-19 in a Montgomery County hospital, with 10 of those individuals requiring a ventilator, which is approximately 14%. So our hospital numbers continue to slowly trend downward, which is a very encouraging sign. There's no update from the Montgomery County Correctional Facility. All of the inmates there remain stable with no new cases of coronavirus to report. As I hope you know, the county now has 6 COVID-19 testing sites open around the county. None of these sites require a car to be tested. These sites do require an appointment. These county-run sites provide testing at no cost, though insurance will be billed if you have it. We do not require a healthcare provider's order, and we will test individuals of any age who want or need to be tested. The cost of these sites is being covered by CARES Act funding that has been allocated directly to Montgomery County. The test sites are open at the following locations and hours. In Pottstown at the Montgomery County Office of Public Health, 364 King Street in Pottstown, Monday, Wednesday, Friday from 12 to 2, and Tuesday and Thursday from 4 to 6. In Lansdale, 421 Main Street, Monday, Wednesday, Friday from 4 to 6, Tuesday, Thursday from 12 to 2. In our Willow Grove Office of Public Health at 102 York Road, Monday, Wednesday, Friday from 12 to 2, and Tuesday, Thursday from 4 to 6. In Green Lane at Deep Creek and Snyder Road, Monday, Wednesday, Friday from 4 to 6, and Tuesday, Thursday from 12 to 2. In Ardmore at 114 West Lancaster Avenue, Monday, Wednesday, Friday from 4 to 6, and Tuesday, Thursday from 12 to 2. And finally, Norristown at 1401 DeKalb Street at the Delaware Valley Community Health Center. This site is open Monday through Friday from 10 until noon. To register for a test, you can go online at montcopa.org/COVID-19 and click on the County Testing Information button. Or there is phone registration available by calling 610-970-2937 starting at 8:30 in the morning on the day that you would like to make an appointment. So those sites are open and available, and we look forward to testing you at one of those sites. Just as a reminder, you do need to park your car, and if you do drive there, and walk up to the site. But we are not allowing people to just walk up without an appointment. We do need to ask you to make an appointment to be seen. If you're not able to get an appointment or one of those sites is not convenient for you, as a reminder, both CVS and Rite Aid are offering no-cost drive-through testing. You must have a car at 12 different locations in Montgomery County. You must also be 18 years of age or older. And you can see a list of those locations at montcopa.org/COVID-19. Under the County Testing Information button, click on Testing Sites Map. And if you hover over any of those individual dots on that map, you'll see information for that particular site. Also, this Saturday only, we have another opportunity in Norristown at the Siloam Baptist Church, which is at 1329 Willow Street in Norristown. On Saturday from 10 a.m. to 2 p.m., the Black Doctors COVID-19 Consortium will be offering free testing. They will test individuals of any age, and no appointment is required. And again, that's this Saturday only at the Siloam Baptist Church, 1329 Willow Street in Norristown, between 10 and 2. And again, you can just show up. No appointment is required. No doctor's order is needed, and it will be no cost to the person being tested. So, as you may remember, we entered the green phase on Friday, June the 26th, and our goal remains a responsible reopen. Green does not mean go back to what your life was before the pandemic. Green means carefully and cautiously moving forward to our new normal, living with this virus for the foreseeable future. Our goals in this phase are clear. We want to make sure that our schools will be able to open this fall. We want to support our local businesses that have opened responsibly. We want to keep the amount of virus circulating in our community as low as possible. This protects all of us, as well as our hospitals and first responders. So how do we do this? Number one, wear a mask. The Secretary of Health has now issued a universal face coverings order. This order mandates the wearing of a mask, with a few exceptions, inside all public places. The mask must be kept on, covering your nose and mouth the entire time you are in that place of business or other public place. It also requires wearing a mask outside. Again, there are a few exceptions, but if you're not able to consistently maintain social distancing, you need to have that mask on outside as well. This order was issued for a good reason, because universal mask wearing in public has been shown to substantially decrease the spread of the coronavirus. Please don't leave home without a mask or face covering, even if you think you won't need it. You should have it with you just in case. Number 2, maintain social distancing. Wearing a mask and maintaining social distancing is key to reducing the airborne spread of the virus. Masks alone are not 100% effective, particularly the cloth masks that we're all wearing. But masks, together with social distancing of 6 feet from non-household contacts, does reduce the spread of the virus, and it's the way to be as safe as possible. Number 3, keep those hands clean. You know the drill. Wash your hands with soap and water for at least 20 seconds, 30 seconds, however long it takes to sing happy birthday twice. And if you don't have soap and water available, use hand sanitizer. Get tested. That's number 4. Get tested if you are worried that you've been exposed, or you think you're having symptoms, or you just want to be tested. Maybe you're going to visit an elderly relative or a friend that has some serious medical conditions. Get tested before you go. The more we test, the more we know. And 5, if you do test positive, please cooperate with contact tracing. I just can't tell you how important this is. We need to know where you've been and who you've been in contact with. This is all kept confidential. No one will be told that you were positive and that you might have exposed them. But by cooperating with contact tracing, this will help us make sure that any outbreak that might start in our community is quickly brought under control. So please help us with that. You are the key to making sure that we can help keep this virus under control. Now, here's another reason why contact tracing is so important, and I'm going to turn now to speak about restaurants. I'm sure you've all been seeing in the news that other states have had very serious outbreaks associated with bars and restaurants. Many of those states and cities are closing their bars and restaurants. So far, we have not seen outbreaks associated here in Montgomery County with bars and restaurants. And many of our restaurant owners have invested a lot in reopening safely. We want to support these restaurants. We do not want to have to shut down restaurants that are doing everything right because of a few bad actors. So with this goal in mind, I have asked our Office of Public Health to strictly enforce all restaurants' guidance. And you can see that guidance on your screen right now. We have a process in place to quickly shut down restaurants after our inspectors observe the second incidence of non-compliance. We are instituting this strict enforcement in an effort to support our restaurants and bars that are operating responsibly, and to help make sure that we don't have any outbreaks associated with our restaurants or bars. In addition to taking your business elsewhere, please feel free to report a restaurant that is not meeting the guidelines that are on your screen. Send an email to covid19@montcopa.org. That's covid19@montcopa.org. All reports will be kept anonymous, but our restaurant inspectors will act on those reports, and they'll go out and they'll take a look, and they'll see if any next steps are warranted. So another question that's been coming up a lot lately is who's been getting, or what is the age of people who are getting COVID-19? So we wanted to share this graph with you. This graph shows the 7-day running averages of age groups by decade through July 3rd here in Montgomery County. Like other places, we have seen an uptick in cases in the 20 to 29-year-old age group, which is shown in red. the 10 to 19-year-old age group, which is the dark blue, the 30 to 39-year-old age group, which is the orange colored line, and the 50 to 59-year-old group, which is the dark green. So you can kind of see that cluster of 4 lines there on the far right of the graph. Now, interestingly, all of those age groups are starting to come back down to kind of the more baseline normal spread. We definitely did see some younger individuals sort of in the 18-year-old range during senior week that were in clusters turning positive. But all of that seems to be settling back down here in Montgomery County. So again, just want to share this data with you to remind you that doesn't matter how old you are, nobody is immune to this disease. And please be mindful of how you're conducting yourself when you're out in public. You've got to maintain social distancing. You need to have a mask on, or you will catch this virus. And even if you yourself don't get sick, you might transmit this virus to someone who becomes seriously ill. So again, please be careful. I know we're going to get through this. We have to stand together as a community to get through these next challenging months until we have a vaccine. But I know that we can do it because you have proven that over and over again during the last 18 weeks. So with that, I'm going to turn over to Commissioner Lawrence.
Good afternoon. I'm going to share information about rent and mortgage assistance programs available. Montgomery County Health and Human Services partnered with the Pennsylvania Housing Finance Agency, PHFA, to offer a rent relief program for low and moderate income renters during the COVID-19 pandemic. Applications opened on July 6th and will be accepted until September 30th, 2020. Payments to $750 per month are available for those who qualify for a maximum of 6 months between the time period of March 1st and December 30th. Funding is provided by the PHFA through the Federal Coronavirus Aid, Relief, and Economic Security Act, CARES, which is apportioned at $50 million for rent relief. Applicants must be Montgomery residents who have lost more than 30% of their income due to work hours or wages, or have become unemployed after March 1st. Income before March 1st must be no more than 100% of the area median income, or $96,600 for a family of 4. An income table for the program is available at www.montcopa.org/HHS and by clicking on the RRP logo at the top of the page. You can also find out more information by calling the Montgomery County Office of Community Connections, our Navigants, and you can reach them at 610-278-3929. And for homeowners, residents in need of emergency mortgage assistance can apply directly to the PHFA by visiting www.phfa.org/PACares. Homeowners may receive up to $1,000 a month for a maximum period of 6 months between the time period of March 1st and December 30th, 2020. Applications are available, can be accessed by clicking on the Red CARES banner on the Pennsylvania Housing Finance Agency's website at www.phfa.org. And their toll-free call center is available at 1-855-UR-HOME, and that's 1-855-827-3466. They are available weekdays from 8 a.m. to 5 p.m. to assist the public and help with questions about the programs. Callers should listen for the prompt mentioning CARES assistance for renters and homeowners. And that concludes my report.
Thank you. All right, so our next virtual briefing will be on Wednesday, July the 15th at 3 p.m. And with that, I'll take any questions.
Thanks, Commissioner. This afternoon, we're joined by Jim Melwert from KYW 1060 and Peyton Potter from Patch.com. We will start things off with Jim.
Hey, you addressed pretty much my main questions with bars and restaurants. And also, I was going to ask about the evictions moratorium expiring on Friday, but sounds like Ken got that. I guess I would ask, through contact tracing, have you found any issues, any potential hotspots, any problem areas, anything, not just bars or restaurants, but kind of anywhere or any patterns?
Yeah, actually, let me go back to the evictions moratorium. I do want our residents to know that Commissioner Lawrence and I did send a message, an email to the governor earlier this week, encouraging him to extend the moratorium on evictions and foreclosures. We believe that he has the ability to do that. It is our understanding that he is considering that, and we are very, very hopeful that that will be the case. Because although this rental and mortgage assistance is absolutely critical, there is a finite amount of money in that pot, and we believe that it will not be enough to help every Montgomery County resident who would qualify for it. So because of that, and because of still very high unemployment in the county, we have asked the governor to extend that moratorium. So we are hopeful that he will do that, but we'll have to wait and see from his office. So in terms of what we're seeing with our contact tracing, so far we have not seen any outbreak associated with any particular place of business or restaurant here in Montgomery County, nor any particular beach community in New Jersey. We have definitely seen people here and there, you know, 2 people here, 1 person there, become positive associated with a visit to the shore, but nothing that I would, you know, describe as any kind of outbreak. We are increasing our surveillance around travel to the high-risk states that are states around the country that are experiencing very significant outbreaks. We have been asking consistently about travel, but now we're going to do that a little bit more carefully and a little bit more robustly to see if we are seeing individuals who had to travel for whatever reason to Florida or Texas or Arizona, for instance, if they are picking up COVID there and then coming back here. That would obviously be a concern as well.
With other states, obviously New Jersey, the key one, imposing or requesting, I guess, quarantines. Is there a similar request or any advice from you for people who travel to other states, including Delaware? I don't know if that's a concern for you.
Well, currently the governor is recommending self-quarantine for 14 days for anyone who has traveled to one of, I think it's up to 15 states now. You could certainly check their website for that current list. And I would echo that. Unless you have a really good reason to travel to one of these high-risk states, then I would urge you to think twice about that and to see if there's any way, if it's a business reason, if that business could be conducted remotely, and if it's for personal reasons, if it would be possible to postpone that trip until a time when the amount of virus in those states is lower. You know, again, this is all part of learning to live with this virus. Until there's a vaccine, there's always going to be virus circulating in our communities. And so the decision that each person has to make is what's the risk and the benefit of any particular activity. So to travel to some of these states now, which are seeing just extraordinary numbers of new cases every day, is a risk. And you know, a person should consider their own health, the health of their household contacts, if a trip could be postponed, and make their own assessment. But I would certainly urge people to try to, if at all possible, postpone that travel.
That's it for me. Thanks.
Okay.
Thank you, Jim. Next, we'll turn it over to Peyton Potter.
Hi, Commissioner. Thank you for letting me join today. I don't usually cover this area, so I apologize if this information is already available somewhere and I've missed it. But I noticed today that you spoke about the rates of positive tests by age group. And I'm wondering if you have any data or a graph that shows rates of testing by age group to kind of pair alongside that?
I don't believe we have that. And it would be quite difficult for us to actually get that because I don't know that we have data on the number of people within each age group in our county. We probably have some approximate census data that would give us that information, but then we would have to look at all of the tests done. We have data on all of the tests done in Montgomery County. But how easily that could be broken out by age group, I'd have to find out. So we can certainly look into that. On our hub website, which is our moncopa.org/COVID-19, we do have age cohort data available there, but it is not broken down by the number of tests per age. No, I definitely understand what you're asking. Well, we'll have to see if we could get that. I don't know that we can.
Okay, well, thank you anyway, and thanks for a thorough briefing today.
You're welcome. Thanks for joining us.
We have no further questions today.
All right. Thank you, Todd. Okay. Thank you, Megan, for interpreting today. And we will see you all next Wednesday at 3 p.m.